about PRP. PRP stands for Platelet Rich Plasma. And the definition of PRP is that it's when we harvest platelet-rich plasma from the blood, and then we will re-inject it into a body part that needs rejuvenation or stimulation. The history of PRP, we first heard of PRP in the 70s. They used it in an open heart surgery. So that's the first medical evidence that you can find that they had the idea that if they took this component of the blood, it would help the human heart. And I don't guess that had a very big impact because we don't see that much more about that in history. But you fast forward, and some of you have maybe heard of friends or family having PRP in joints. Some of you that know me well here know that I had 8 years of truly painful elbow, and went to various doctors, and that was something that they wanted to do for me. And thankfully we learned it was just an injection problem, and I changed my technique and got better. But that was something that they wanted to do to help me after 8 years of suffering with cortisone shots and things like that. So big use in orthopedic world and fairly effective in the orthopedic world. So around 2007, we started seeing studies come out about using platelet-rich plasma for hair restoration. And if you read the studies, it's interesting because they're like, needs more work. It needs more work. Around 2013 and 14, you started seeing the shift in the studies that, wow, this really does have an impact. 62 of 64 people saw positive hair growth. And now the studies in 16 and 17 have been really big. So we've been really excited to get this here. They've been doing it since '07, but they're gonna conglomerate a lot of studies that have a lot of positive results before they ever bring something to market. We're not gonna take it until we see consistently.
But just as the last couple of years,
they've really been bringing it out. Yeah. I think we're gonna start seeing PRP, well, I know, because reading the studies, you're gonna start seeing PRP used in a lot of things, and especially the vampire facelift has been very popular, brought forth by the Kardashian girls, of course. And that is where, we're gonna talk about that a little bit, that's where they're taking the blood component and re-injecting it or microneedling it into the skin to stimulate skin cells. And that's been wildly popular for years. So that's something that we've brought out too, just because we have the equipment now to do that. Some people don't want synthetic fillers, or because of health reasons can't have synthetic fillers in their face. So PRP in the regards to hair restoration is going to work in 3 ways. As we age, we start to get miniaturization of the hair follicle. It starts to get very small. So whenever we inject PRP, it's going to help that follicle get thicker. So you may be going along thinking, my hair looks just a little thinner, and then you realize, wow, I've lost a lot of hair, but the hair I have has gotten almost cat fine. So that's something normal with the aging process. So PRP is going to stop the shedding. It's going to thicken the hair follicle, and it's going to actually stimulate new hair growth. This little presentation makes me dizzy. Causes of hair loss. Hair loss is caused by one or more of 4 variables, which can be either hormonal, vascular, nutritional, or inflammatory. So it can be any one of those 4 factors. Prime candidates for this PRP are males and females that have normal pattern balding, which is 99% of the people that we see. Occasionally, if I'm talking with someone and they're having some issues, we'll say, well, why don't you just get checked out with a physician, get some blood work done to make sure your thyroid's okay, and variations like that. We see a lot of thyroid issues in the practice because we have a lot of women who are over 45, 50 years old, and they're the ones that are gonna have a lot of thyroid issues. Clients with traction alopecia are prime candidates. Those would be clients that have either worn a woven piece in their hair, or they've worn extensions for a long time, and that constant pull on the hair causes the hair to fall out. So as long as the hair isn't scarred, as long as the scalp isn't scarred in that area or really inflamed, that's gonna be just fine to help them grow new hair in that area. We wouldn't do it on a scarred area. We'd have to examine that up close and see if there's scarring in the area. And then clients, we get this question a lot because we have a lot of clients who have gone through chemotherapy. We actually have an oncology aesthetics program here. And whenever clients are coming back from chemotherapy, they finish their treatment, the drugs are exiting the system, and they start to have new growth of hair. it will actually work to help that hair grow in a little more quickly and a little thicker. A lot of people who have gone through chemotherapy never quite grow the hair that they had to begin with, and this will actually help stimulate a little bit more hair growth. You doing okay, Sam? Sam's got his little Pronox tube going, so he's doing well. Now, poor candidates for this treatment would be people who have extremely thin or bald heads. The rep couldn't be here with us. He was here earlier today. The rep for this company is cue ball smooth. And he says this wouldn't work on me because I just don't have enough hair to make it work. But if you have just the little bit around here and you still have a little bit of hair growing in here, we can actually help it grow in together a little bit more. People who have blood disorders. If your blood is not healthy, not producing platelets properly, it might not be that that particular plasma would stimulate hair growth. So that's something that if you guys are interested in this tonight, it's something that we need to sit down and talk about your health history just to make sure that you're a healthy candidate for this treatment. If you had an active infection, if you had an infection on the scalp, we wouldn't want to inject you. At the same time, if you had an infection in your body, we would want to wait until you're well to do the treatment. People who are on prescriptive blood thinners, the blood thinners will change the platelet formation in the blood, so that's not a good candidate for doing the treatment. If you're on Coumadin or something like that, we would probably need to find something else.
What about aspirin?
What was that?
What about aspirin?
Aspirin is okay. It's Sam's actually on. I have Sam on aspirin therapy. Remembered yesterday, oh, you're still on aspirin therapy. It would just make you a little bit more oozy whenever we do the treatment, but it would be okay for the treatment. That wouldn't matter. But you might get a little bit of bruising on the head just because you're on the blood thinner, and when we put the little needle in there, it can ooze under the skin a little bit. So aspirin, ibuprofen, Motrin, we would ask you to come off of if the doctor didn't prescribe it for you. Omega-3s, glucosamines, there's some supplements that we would ask you to stop if it's okay with your physician. But, you know, people on Coumadin, they're not going to be allowed to stop that. So that's something that we would probably stay away from. And uncontrolled thyroid disorders, as I said, we would not want to do this and then realize that it was for naught because you really needed to get that situation fixed first. What's funny is Sam is my tech support too, so if I have an issue, we're gonna have to jerk that tube out of your mouth over there. I'm gonna show you a little bit of the before and afters, and you know, we have started this. Is Jane here yet? Has anybody seen Jane? Okay, Jane actually went to see the eclipse yesterday and didn't get home until very late in the evening, so she's coming, but she was gonna come a little bit later. We did Jane's second treatment 2 weeks ago. So from her first treatment, she's starting to feel a little bit thicker back in the crown area already. Jane's somebody that has struggled with thin hair all of her adult life, and we've talked a lot about this. So whenever we brought it in, I called her immediately and said, hey, do you want to come? You know, I'll be glad to offer you a nice deal on this because I know we've talked about it for a long time. So you can see how this, females will usually thin hair first, right up in that temple line. So you can see it just fills in a little bit. It's not going to be a huge, thick head of hair, as I keep telling Sam. Not going to be a big, full head of hair again. This is Dr. Rappaport's picture. Yeah, well, that's what we're working on. This is Dr. Rappaport. Dr. Rappaport actually developed this equipment. He's been seen on several of the doctor's episodes and Good Morning America and things like that because he's known as the PRP guru, PRP Hair Restoration guru. So this young man did the 4 sessions, and then he actually did 2 maintenance treatments before they took his photograph. And we'll get into the schedule of treatments in a little while. This is a young woman who did 4 treatments. And she did nothing else. Some people like to use minoxidil. We have some products that we'll talk about that just help stimulate hair. But she was just PRP. And she actually, as a younger woman, she didn't need any maintenance. Once she did the treatments, her body kind of remembered and took off, and she really didn't need any other treatments again. And as you see, it just fills in slightly there. when we do eyebrows too. A lot of women are excited about that. So whenever we do the hair, we can just do a few little injections at the eyebrow line. Are you ready to get started? Okay. So Sam is ready to get started. And just to kind of tell you the background of what we've done today, because we didn't want to bore you with all the details, we went ahead and drew his blood earlier, because I know my Sam, and he doesn't drink water all day long, and he stays very dry, so I figured that was going to be, and that was. We had to stick him a couple of times because he's just stubborn. So we have his blood. We have spun his blood down. So what we do is we get platelet rich plasma. We've thrown away the red blood cells because whenever we spin, it spins out the red blood cells. We don't need those. And one of the good things about the Eclipse system that we're using is that it will spin those red blood cells out because they're not necessary and they're painful when you inject them. So that's one of the big pros of using the Eclipse system. It's a pure spin. So this is the PRP, platelet rich plasma, and we're going to inject that into the scalp, and that's going to stimulate hair growth deeper in those tissues. This is what they call the PPP, Platelet-Poor Plasma, but that's still liquid gold. We don't want to dispose of that. So what we will do after we inject this into the scalp is we're going to make some small holes in the skin with a little micro needling device and just rub that solution in, and that will give him further fertilizer on top. So I'm going to let Mary work with him.
I'm going to get him a pillow because he's a little low.
He's a little bit low. And I want to do his cul-de-sac. Sam takes a lot of heat from us, and because he has the Pronox in his mouth, he's going to be quiet and behave because I said, you better be quiet and behave, but he can hold his own, so don't worry that we're being mean to Sam. I have known Sam since I was 12 years old, so I can tell you that when we were younger and in high school, when we went to prom, he had the thickest hair. You could hardly get your fingers through it. It was so thick. And has been losing slowly through the years. He was in a car accident in 2006 and had a couple of surgeries, and I think the stress and the anesthesia really helped his hair loss a lot at that time. So he has been struggling. He didn't realize that he had lost so much until I took his pre-photographs, which is the second step that we're going to do, and he couldn't believe how thin he is on top, but he's a great candidate. He has a little bit of hair growth in there, so that's really, he's got enough to say he has healthy hair, and it's going to grow in. So I'm going to keep talking while they're working, because a lot of this is just sticking that little PRP beneath the skin and rubbing some in. So you're welcome to watch them or listen to me.
What kind of needle do you use to do that?
What kind of needle? It's a 27 gauge. Yeah, 27 gauge 1/2 inch. Now I'm going to show you this little clip while they're working because this is Dr. Rappaport.
Hair loss is an embarrassing issue for anyone, but when you're hosting a daily television show, it can be a real problem.
Dr. Ashton is here for a PRP, platelet rich plasma treatment of injections into her scalp for her hair loss.
A month ago, I had my first treatment. I'm here for my second treatment. I looked like a balding man, and it was really starting to bother me. What's involved in a PRP treatment?
We get some blood drawn. We draw up the platelet rich plasma. We will put some numbing cream on your hair before you start, and then we'll inject the PRP into the areas where you've lost the hair. I'm going to do the frontal hairline, do the couple areas that she wants to do, and I'm also going to do the hairline. And we're done, okay?
Whew. That was a little less painful than having a baby.
We're joined by Dr. Jeffrey Rappaport and, of course, our very own Dr. Jennifer Ashton. First of all, thank you for opening up about this.
Well, listen, I know that this affects a lot of people. I hear this from women all the time. Obviously, men deal with losing hair and thinning hair, but it really is upsetting for women. And I was like the first in line pretty much to try this new treatment. And I exaggerated. It wasn't that painful. I have a low pain tolerance.
Before we ask the good doctor,
yes,
are you happy so far?
Oh, it was incredible. I've done 4 treatments. I saw an improvement in this area and this area, which was really where I mean, look at that. You could see right to my scalp. I started to see a difference in 2 weeks. Now it's been about 4.5 months, and I see a huge improvement.
So
All
let's
right,
talk
Dr.
about
Rappaport.
PRP, right?
Yeah,
It's
so-
used for so many things.
Platelet-rich
Plasma.
Yes.
How is it helping in hair loss?
Well, the plasma has a lot of platelets in it, and the platelets have growth factors. There are about 7 growth factors in the platelets, and what that does is 3 things. 1, recruits new hairs to grow. Number 2, keeps hairs that are there growing, and most importantly, stimulates the stem cells that are around the follicles to get thicker. So that reverses the miniaturization of the follicles.
So really different than any other technique that we've used in the past.
Well, in the past, there's been surgical technique, as you're well aware of, and then there's the non-surgical technique, but there really hasn't been a game-changing technique like this where we can see results that are really quite substantial.
So as a game changer, the thing I always am curious about is the accessibility of it. Is this something that is fairly easy to find someone able to do it? How much would it cost? Those kinds of things that matter a lot to our viewers.
This is one of the best kept secrets in dermatology. There are very few dermatologists out there that are doing the treatment. I really don't know why. The study in the key journal Dermatologic Surgery showed that 62 out of 64 people got positive results. It's not going to be so easy to find people who are doing this type of treatment. In my office, we charge either $400 to $600 per session. The price varies throughout the country and depending upon what technique is used.
Yeah.
You want to know what's funny? When we talked about studies, you know how you know a study has been done and a really good one? It's when Dr. Ashton gets the treatment. Because this one here, she knows her medical research. We've talked a lot on the show about PRP therapy. Some of the things it's being used for really don't have the great evidence. For other things we do, sounds like this really is going to be one of those game changers because a lot of people have thinning hair and a lot of people don't want thinning hair. I'll tell you, hopefully coming somewhere near you, we'll of course have more information on our website, thedoctorstv.com.
Thank you.
Thanks for taking such good care of Jen. And Jen, you do look fabulous, if I may say.
Found her treatment. So, can you guys see okay? Because you're welcome to see Sam a little closer if you want to. He's getting a little red, but he hasn't moved, and I'm telling you. Yeah. Yep, she's doing, so we start right close to where we have healthy hair growing, and we'll move in a little bit to the thinner areas.
He still has healthy hair here.
Yeah, it's very sparse, but he still has some hair growing in there.
He still has hair right here.
We call that his soul patch right there. He's got one, why, don't know why, but it hung in there. But yeah, I'm very proud of you, Sam. You okay? I think he's asleep. I think he's pro-knocked out. Uh-huh.
Do you use the same numbing
Cream?
cream
Yeah.
that you do with Proctora?
Yes, I do.
Okay.
I do. We did on Sam. Some people, it hasn't bothered some people enough that we need the numbing cream. But if we talk about it and there's any hesitation about discomfort, we'll go ahead and put the numbing cream on. If there's, like you have a lot of hair, so we wouldn't want to, well, but it would get kind of messy. So we would section it off with some little clips and numb down at the hair base. Yeah. Does anybody else have any questions right now? Uh-huh.
So how many, if people get like the pictures that you already shown where it pretty much covers, how many
Treatments? Yeah, this is the treatment schedule, and this is pretty typical. I did a lot of research around the country just to make sure that everybody's on the same page. And you do one treatment every 4 weeks for a total of 4. And then after that 4th treatment, you'll never have to do that series again. Now, PRP lasts in your system for 12 months. That's how long active PRP that we take out, we spin down and get that platelet-rich plasma is going to be active. But it peaks at 3 months. So you peak at 3, but you're going to last for 12. We recommend you get a maintenance treatment at 6 months. And that way you're never going to have that dip in that PRP fertilizer. You'll continue to grow. Right. You just do a single treatment every 6 months. Yeah. Yeah, Kenny? It probably will. Yeah, eventually your aging process take over again, and it would start thinning out again.
aging process
It can be testosterone, it can be nutritional changes, you know, it can be inflammatory processes going on, so it can't be, yeah, yeah.
And sometimes they just don't know.
And sometimes they just don't know. You're exactly right. You're exactly right. Yeah. Does anybody else have questions? Oh, I'm getting to that. I'll tell you in just a second. What was your question?
My hair's been thin my whole life.
Yeah.
Would this work for me?
Yes, that's they.
I mean, since I was like a teenager.
Right. Has it gotten even thinner? Yeah. So we would probably help. We wouldn't ever make it thicker than it was as a teen. Right. But where it's gotten thinner since those years, we could thicken it a little bit compared to where it is now, I would expect. Yeah. Okay, so Mary has finished with the injections. So what she's doing now, she has a little microneedler. What she's actually using, for those of you that know us, is the tip to a fractura. And she's just taking that fractura and she's making small microchannels in the top surface. So we have put PRP deeper in the tissues, and now she's taking the Platelet-Poor Plasma, even though it's poor, it's not poor, it's still it's liquid gold that we're gonna rub in to those little microchannels that she's making. And this is the last step. So she's almost done. It's a quick treatment. Yes, sir?
So after the treatment,
Yeah.
is there a precautions steps that we need to take?
There is, actually. Let me get to that so I don't forget to tell you anything. Let's see here. So let me find my place here. Well, I can't find my little button there. Let me just tell you. We would like for you to come to the appointment with clean, dry hair. If the females have been out and your hair sprayed up, it's okay. We'll just brush it out, and that way we'll be able to work in your hair a little bit easier. We ask that you drink a lot of water the day of the treatment because we're going to need to draw blood, and we need to find a nice vein there. Ask you to bring a hat. What, Sam? Sam didn't drink water all day long. I was so mad at him a while ago. Bring a hat because you're a little messy when we're done. And if you needed to make a pit stop on the way home, you'd want to have like a ball cap or something to put on to hide your hair. After the treatment, we ask that you don't do any hair coloring or keratin treatments or anything like that for 3 days. 3 days before and 3 days after. No professional salon treatments. You go straight home from the treatment, just take a warm shower, wash your hair, and you can continue with your normal styling products. That would be okay.
What does genetics fit in with all this?
Genetics, well, genetic balding, just male and female pattern balding is what most people deal with, and the miniaturization of that hair follicle. So that's actually why they started looking into this, is just to treat normal pattern balding. If your genetic pattern is that you're going to lose all of your hair, this might help you stall that. It might not be able to prevent that completely. Yeah. Yes? Yeah, you need to watch the sun for about a week after. Just like anything else, whenever you have an injury, you don't want to go get it sunburned. So I would recommend wearing a cap and some sunscreen if you don't have a lot of hair, or at least a ball cap for the next week whenever you go out. Here comes Jane. I see her coming in, my model from last week. We have a couple of products I wanted to tell you about that help. And I always say these products are a lot like what we do on the other side. The ladies that come to visit us, you know that we do treatments, and the treatments do a lot of good. We have products that are wonderful, but if you come in, I can't say, I'm gonna sell you this cream and it's gonna be a miracle cream that's gonna change your whole world. There's not a miracle cream like that out there, and there's probably not a hair product like that out there. So the iGrow is a laser device. It's a low-level light device, and it's a little helmet that you wear that you're able to plug into your computer and listen to music and relax. You wear this about 3 times a week for 20 minutes, and it will help stimulate that scalp more. So if you have done the PRP treatment, this is going to help stimulate that hair growth even more. So that's something extra that you could do if you did PRP and you wanted to get the best bang for your buck, the best result. They also carry some of the Ducray products They have a strengthening shampoo and conditioner, and those are wonderful for just preparing the scalp to accept product whenever you use their product called Neoptide. Now, Neoptide is a product that's gonna slow down that enzyme production. That's the main cause of hair loss. So that's why you would use this one. And then they sell also minoxidil. And this is the same product that you can buy at CVS. We just carry it here for convenience sake. But minoxidil, of course, is gonna help stimulate and grow fuller, thicker, healthier hair. So those products are also wonderful to use whenever you're going through the PRP process. You fertilize this and stimulate this in every way possible, inside and outside, just to get the best result that you can.
So would you do this on a daily basis?
Yes, you would do the hair care products on a daily basis. And the iGrow, as I said, would just be 3 times a week. And a lot of people just, whenever they sit down at night to watch TV, they put it on. We've sold the iGrow for many years, actually, and people will say in about 6 months they have all kinds of baby hair, and that's wonderful, but you see where the PRP is actually a little better, a little faster. That would help, the iGrow would help the PRP process. And just mentioning the PRP facial, it's the same process. I mentioned that, that vampire facial. We can't call it the vampire facial because Dr. Runnels will make us pay him $10,000 to use that name, and I think that name's offensive anyway. Vampire facial. You draw a little bit of PRP out or a little bit of blood out, same thing, spin it down, and then we take that PRP and we inject it, as I said, into lines and folds. We can also inject it around injectable fillers so that it just fills it out a little bit more. I actually pulled some pictures for you guys just to see what that's all about. And you can see on him, we don't want our men to be completely smooth, but this is nice just to, he still has some nice character lines, but it just made him look a little bit rested. And a lot of men don't want to talk about injectable fillers because they worry about feminizing their faces. And done properly, it wouldn't do that, but men shy away a little bit from doing any kind of injectable filler. And you can see just, it's made him look a little more awake. He's not too smooth, he's just a little bit more awake.
Looks like he had the hair treatment too.
He does, doesn't he? But he didn't, that was not listed in the literature on him. But I thought the same thing, maybe it's just longer. She actually had some filler in her lips, but she had PRP around it and under her eyes. Who said something about it looks like Botox? Yeah. It's not. Botox will make the muscles and the nerves not talk to each other. So that's how, whenever we inject that into a muscle, it just helps it relax. And PRP is actually going to stimulate collagen in the tissues and make the area smoother. So you can still see his crease here, but it's just a lot better because we injected, or we didn't. He was injected with PRP there, which that would be about the only thing that we would ever inject there, because that, whenever you inject any material in there, there's some risk involved that we don't want to think about. So PRP would be safe to inject there. And a lot of men get that. That muscle just shortens over time and it just draws in. A lot of females do. We treat, that's one of the #1 things we treat here for females is that frown lines. And she's a good one. You can tell she didn't have any injectable filler in her lips, but you can tell her entire face just looks a little bit softer. And that's from injecting all that collagen-rich PRP beneath the skin, and it stimulated collagen. So she still has her, what they call smoker lines, even though everybody gets them not smoking. She still has those, but she just looks a little smoother through there, and she looks filled in under her eyes. It's a nice effect. All right. And
that's probably something you'd have to keep doing every 6 months?
you know, no, it's funny. In the face, it's a different story. In the face, we do the 4 treatments, but it lasts 18 months or so. So it lasts a lot longer in the face than it does in the scalp. And you know, it's funny, in the face, you can look in the mirror and say, you know, I'm not looking exactly the same. I probably need to see if I need to do a maintenance treatment sometime. Your hair can get away from you. So you don't necessarily have to do that 6-month maintenance treatment, but we want you to come in and let us take photographs of the hair and take a look, just to make sure that it's not getting thinner and you don't realize it. Did you have questions, Anya?
Yeah, on the PRP
It's a tightening. It tightens. It's
And you said it's like every 18 months?
yeah. Well, yes. Now we do a few initially, like 4 monthly, to get the process going, and then we usually check in on that 12 to 18 months. How are you feeling, Sam? How what on a scale of 1 to 10? 10 being the worst pain you've ever felt. What would you say?
4.
You, really? 4? This is from the man that stubs his toe, and it's a 12. So I'm proud of you.
I should never have the gas around when I do that.
I'm going to take the gas home. We drew his blood, and it was a 12. Yes. He actually was wiggling whenever we were trying to draw his blood. So, okay. Does anybody else have any questions before we go on? You guys have good questions.
Is this the first treatment for him? Or
Yes, this is his first treatment. Yes. Oh, Jane's here. Come on up, Jane. So, oh, yeah, but we put the numbing cream on him.
Yeah.
Can you believe that, though?
No.
How well he did?
Well, I'm sorry I was a little late.
No, you're fine. I told them that you had Eclipse Fun yesterday and that you'd be joining us.
Yes, we got stuck in a lot of traffic. But I've had 2 treatments, and the first treatment was more toward the back of my scalp. My mom had very thinning hair, as did a lot of the women in her family, and that was one of the genes I inherited as well. And so I had, you can see my scalp, and but it's getting much better. But the first treatment was here, toward the back, and I did not use the gas. We just used ice, and Chrissy's really good. I'm a hard stick, and she didn't have to stick me twice to get blood, and spun it all
See,
up
Sam?
and all that. and I went home and took a hot shower, and I just had a little bit of tenderness the next day. Maybe 2 days after, when I would wash my hair, it'd be a little tender. The second treatment, we did a little more here.
Which is not, let me just interrupt you to say, that is not typical. When we did Jane, we were just kind of playing around with part of her scalp. So your second treatment would actually be considered your first for everything.
I see.
You've had 2 here, but we're
Yes.
not going to count that first treatment. We just were
I see. Well, it was,
testing it on the back.
more here, and I was a little more tender.
Yeah.
So we started out with the ice, and I said, I think we might need a little bit of the gas, and we used that. And we also did a little of the micro needling after, and I had much less tenderness the
Good.
second time.
good.
So yeah, that's I'm very excited about.
Yeah, so we're just waiting to see. That will be her second treatment. We were talking the other day that she looked actually even like she might have a little thicker.
Yeah, I feel like I have a little more fullness when
In
we
the
did
crown.
the first treatment, and I too use minoxidil, and that has caused little baby hairs, but I think that this is going to get me where I want to go.
A little bit thicker.
Oh yes, absolutely.
Yeah.
So.
I'm excited to see you. I'm so glad you all came. This is a fantastic turnout for something brand new to our area. There is not a lot of people out here doing this. And of course, like everything else, it's more popular in Chicago, New York, and LA. And we try to look, that's sort of our focus here, is to try to find the things that you don't really find in a small town and bring them in to us, because they're wonderful. This is a no-brainer, honestly. This is your body, so you're not going to be allergic to it. You wouldn't have an allergic reaction or some weird side effect from your own plasma. So it's extremely safe. The studies say that it's extremely effective, and we've been really excited to read and review all of that. So we're thrilled to bring this in.